Doc, listen, I really appreciate you joining us on such short notice. And I wanted to discuss your thoughts on the evolution of the field. I was fortunate enough to have the opportunity to interview Bob Bernstein on my live show on Tuesday. And Bob has really embraced the ARTAS robotic hair transplant system. Now, initially, I was a little concerned about the direction that the industry has been going in. Bob has, obviously he's a very conservative guy. He is one of the leaders in follicular unit extraction, and he really believes that this is the direction the field is going in. I want to know your thoughts, and if you really think that these devices are the way to go.
Well, thank you so much for having me on the show. I have been involved with the evolution of hair restoration, especially in last 2 years that I've been the chairman of FUE Research Committee. We have 17, doctors mostly doing FUE or a combination of FUE and a strip. And the idea behind this, committee in International Society of Hair Restoration is that we have to put together some research projects and some studies to see what is working better and how we can be more efficient.
Right.
ARTAS is one of the projects that we're going to be working on now. But at this point, many of the doctors who are actively doing FUE are not bringing ARTAS on their practice. And I've been looking at it. I've been watching this very closely because obviously, if there is any benefit of adding this, device to my practice, I want to have it.
Of course.
So I haven't seen that yet. You are right, and Bob is right. That might be the future. But the technology that is there, the speed, the efficiency of FUE by ARTAS is not quite there. And it's not a comparison to someone who is doing FUE on a regular basis and is really good at doing FUE.
Well, you see, this is my concern. I brought that up to Bob. Bob says that, in his hands, and now that they're using another iteration of punches, a 0.9 millimeter punch, he's saying that in his hands, under his direction, that the ARTAS is really, there's no comparison. But I am speaking to other doctors like yourself and many other doctors in the field who do not believe that this is the case. But this is what I see. Excuse me. What I see is that there is absolutely no doubt that this is the way the industry is evolving. And you love it or hate it, I think that the marketing of these products or this robot is it's pretty compelling. And the consumer sees that and says to himself, hey, you know what? This is a robot. This has to be this has to be state of the art. And I think that a lot of the physicians in the field are going to start to feel the economic pressure and feel like they're going to be left out in the cold if they don't get their hands on one of these devices. Do you agree with that?
This is one of my initial thought, and we are going to this, seminars, and we have, talks about ARTAS, and the doctors who are buying it. I'm very curious. Obviously, I approach them and say, okay, how do you think you've been doing FUE? Now you're doing it with ARTAS. Does it make sense? Did it help your practice? And more than anything else that I'm hearing is that yes, marketing-wise, it's helping us. So it's not much talk about the science behind it and the quality of grafts or the efficiency of the FUE. It's about, yeah, you should have it because, as you said, ARTAS is a good name, and you should have this new technology.
But that's the problem, and that's why I think that maybe like your committee and some of the other guys should start to focus more on working with the ARTAS in some capacity and maybe improving on the machine, because there's no doubt in my mind, the industry is kind of spreading out. There was a major aesthetics meeting in San Francisco a couple of months ago. After that meeting, I was contacted by 6 board-certified plastic surgeons. They wanted to know my opinion, and this was in the same week. My opinion on whether or not they should either go for the ARTAS or they should go for the neograft. These are guys
Right.
who have never performed hair transplant surgery in their life. So this is what's going to happen. These guys are being marketed to by these companies. These guys are going to get into the field because we all know that surgical hair restoration is a good way to make a living, and it's a good way to expand your cosmetic surgery practice. And if there's a company offering a device that could bring in an extra $10,000 bill every day into this practice without very much effort on the doctor's part, they're going to look at this very, very strongly and really make a consideration. What does that do to the field? That waters down the field, and all of the guys like yourself who are true experts in surgical hair restoration. Sadly, if you don't keep up, you guys are going to lose out, because honestly, in the consumer's mind, who are they going to go for? Are they going to go for the emergency medical specialist who happens to have the best hands in the business and be a great hair transplant surgeon? Or are they going to go for the board-certified plastic surgeon now claiming that they're also an expert in hair transplantation?